Hi guys, Heather here. So a viewer had asked me whether I think taking care of 7 patients is too much, and heck yeah, I think it's too much. Taking care of 7 patients should be illegal. And now that I think of it, taking care of 20 patients in a nursing home should be illegal. But maybe since they're not like acutely ill, it would be okay, but I don't know because I've never worked in a nursing home. But maybe having 7 patients on night shift would be okay, but I'm not even sure about that. Some new grads like to work night shift because they say it's like a little bit easier to manage your time. It's kind of less busy, although it does depend on the acuity of the patients, because if you have a patient trying to climb out of bed, yeah, your night's gonna be really busy for sure. Get ready for a night of running in the patient's room when they set off the bed alarm and trying to convince them to stay into bed. It's exhausting. I would almost take any other patient rather than one that doesn't want to stay in bed. Who doesn't want to stay in bed? I like to sleep. It's almost as bad as the patient that keeps bending their arm and the IVs in their AC and their pump keeps beeping. But at least you know the pump's not going to fall down and hurt itself. When I first started nursing, I worked on a unit where the nurses all started out with 5 patients and they were paired up, 2 nurses like a buddy system. And when we got a 6th admit in the afternoon, or a 6th patient, we both took care of it. So we split up the work and we would answer each other's call lights and cover each other for lunch, and we were like best friends. And I really like that system because admitting a patient when you're a new grad can be pretty darn challenging. Although everything as a new grad is really challenging, right? And after I left that job and went back to California, I had 6-7 patients and I was drowning with my workload. The CNA would come up to me and say, "Oh, so-and-so needs pain meds," and I'm like, "Who's that?" "Oh, that must have been that patient I saw for like 10 minutes this morning." Then shortly after that, they passed along California where it was 5 patients to 1 nurse. And thank God for that, because now I could actually spend time with my patients and know who they were. And then one glorious day I floated to the tele unit and the nurse-patient ratio was like 3 to 4 patients to 1 nurse. And I'm like, wow, this is heaven. Where do I sign up to work here? That's another reason why I fell in love with the tele unit. And I haven't found a better nurse-patient ratio on a unit yet. Except maybe the OR, because you can only have 1 patient each OR at a time. And they most likely won't be climbing out of bed. So yes, having 7 patients is challenging. But if you're super nurse and you want to do that, then kudos to you. Well, thanks everyone for watching. Talk to you soon, Kay. Bye.